Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you as needed. But as always, I like to get into my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have created and designed based on the guidelines that are currently being tested on the AANP as well as ANCC exam. And any of the videos that you see that if I am teaching on things that we currently do in practice, I will always say that so that you won't have any confusion, okay? But with that being said, let's get into question number one for today. Question number one states a patient presents to the office today with complaints of pain to the right thumb and wrist. The patient states that the pain is directly below his thumb and it feels as though his thumb gets stuck at periods of time. Upon examination, the nurse practitioner notes some swelling below the patient's thumb at the wrist. Based on these findings, what is the best differential diagnosis? Is it A, carpal tunnel, B, navicular fracture, C, de Quervain's tenosynovitis, or D, arthritis? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first because it allows you to slow down and ensure that you're answering what is even being asked of you. So the stem of the question states, based on these findings, what is the best differential diagnosis? Now, again, look at those key things. What is the best, Um, so what do we have here? If I always say, if we are looking for a diagnosis or differentials, you have to run it back and see what the assessment finding shows, right? How is this patient presenting? What are we seeing on exam? So the patient is complaining of right thumb pain and wrist pain, right? That's the initial complaint presentation. He's explaining that at some points that thumb feels like it gets stuck. And on exam, the nurse practitioner notes some swelling below that patient's thumb right at the wrist also. Now, when we're looking through these answer choices, even if you get stuck, try to work your way through. For example, A, carpal tunnel. Although we know carpal tunnel is associated with the wrist, there's more so numbness right at that median nerve. So they'll usually say in the middle of their wrist, they have this numbness, or after repetitive use, their hand or wrist and things begin to feel numb, right? Navicular fracture, typically after a fall, where that scaphoid bone has been injured when you're falling and extending your hands out to catch a fall. C, de Quervain's tenosynovitis. That is the best answer. Think about what de Quervain's tenosynovitis is. That is where that tendon is actually inflamed right beneath that thumb region. So classic presentation is they have that thumb and wrist pain. There may be some swelling right below that thumb at the wrist area. And they commonly may describe it as when they're moving that thumb around, it feels as though it gets stuck here and there. Okay. So C, de Quervain's tenosynovitis. All right, question number two. What test should be completed to confirm the differential diagnosis of de Quervain tenosynovitis? All right, so we have this patient in, we were just walking through, and our best differential for what the patient is complaining of, his signs and symptoms, and the presentation and assessment findings was de Quervain's, but we need to confirm that differential diagnosis, right? So, which test do we utilize to confirm de Quervain's tenosynovitis? Is it A, the Phelan sign, B, the Finkelstein test, C, Tennell's test, or D, do we need to complete an X-ray? Take a moment and tell me what you got in the comments, you guys. All right, so here the entire question is that STEM. So, what test should be completed to confirm the differential diagnosis of de Quervain's tenosynovitis? And again, this is a knowledge based question. So, you know how I always recommend studying assessment, diagnosis, evaluation, and treatment. Well, this diagnostic testing or exam that we want to do to confirm that differential diagnosis is B, a Finkelstein test. And you're having them to place that thumb, make a fist, but placing the thumb inside. So, you know how your four fingers will wrap over the top of your thumb. Make sure it's tucked inside. Have them to form a fist. And if it's positive, they will start to experience pain. Okay. So B, Finkelstein test. Remember A and C, the Phelan sign and Snell's are utilized for carpal tunnel syndrome. Okay. All right, and lastly, question number 3. The Finkelstein test is positive and a diagnosis of dequervating tenosynovitis has been confirmed. How should the nurse practitioner treat? Is it A, prescribe methotrexate, B, acetaminophen and rice, C, rice, splint, and NSAIDs, or D, rice, splint, and Tylenol? Take a moment and tell me what you got in the comments, you guys. All right, here, stem of the question states, how should the nurse practitioner treat? You know how to say when we're talking treatment, now you need to run it back and see what the diagnosis is. Look and see if they're providing you a diagnosis. If they're not, then you got to take it back a step further and see what the assessment findings are so then we can know a diagnosis because we can't treat something if we don't know what it is, right? So here it's already been provided. This is our same patient that has carried out. They came in, we learned the assessment findings, we know how they present, and we thought it was Dequervain's tenosynovitis. So we had that as a differential. All right, so we wanted to confirm our differential diagnoses, and we did the Finkelstein test, right? Finkelstein test is now positive. We have a confirmed diagnosis of Dequervain's tenosynovitis. So now, how do you treat this? And I walk you through the steps because, again, you hear me say this all the time, but this is how you should walk through each condition, uh, dermatologic disorder and diagnosis so that you are prepared for boards as well as in practice. Y'all know I always say that because guess what? This is how they're testing you on the exam. And when you get in practice, this is how we work, right? This is what we look at when we have scenarios like this. We picture that patient in front of us, we work our way through. And I know sometimes on the exam, they can give you a lengthy scenario and it seems so vague and random and different terminology. But if you know this foundational knowledge, you will be able to process your way through the fluff that they're providing. Okay. So, again, how do we treat the Quervain tenosynovitis? Do we treat with methotrexate? And know your meds. Methotrexate is a DMARD, commonly utilized for things like rheumatoid arthritis. So, no, that's not our best answer. B, acetaminophen and rice. Now, we do need to do rice, rest, ice, compression, elevation. That does help with this. But acetaminophen, aka Tylenol, is not the best uh, treatment option for this. C, rice, splint, and NSAIDs. Yes, this is your correct answer. You want to instruct them on doing rice, again, rest, ice, compression, elevation. You want to splint that wrist and thumb region to aid in the rest and stabilization of it so that tendon can have some rest and support, as well as prescribing an NSAID because that tendon is inflamed. Look at the word if you get stuck. Tenosynovitis. What does itis mean? It's inflammation, right? So inflammation of the tendon. So we want to use a NSAID to reduce the inflammation, right? So C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure to meet me back here. And if you need any of the resources that I offer, as always, feel free to reach out to the nursing studio at 803-400-6864. You can also shoot a text message to this number or shoot an email to the nursing studio, the number 1 at gmail.com. I offer a review book, ebook option, as well as paperback, both linked in the bio of this channel. I also offer a self-paced review course designed for family and adult Gero reviewers preparing for both exams, AANP as well as ANCC. That is also linked in the bio of this channel. We have an upcoming 5-week review course that starts on June the 10th. I do those periodically throughout the year. And that's actually, I think the last one was purchased. I'll have to double check. But if so, when you try to click the link, it won't let you go. So you can try it if you're looking to join us, but we start in a week. And our one-on-one sessions are designed to either help with a weakness that you need, making a strength, or if you're looking to assess your exam readiness with me, that's another option. Or if you have been unsuccessful before, just need a customized study plan, Or if you just don't know how to prepare yourself for studying, you can do the custom plan and we work through, we see what your weaknesses are. I structure your studies for you and work alongside with you during the duration of time that you are looking to prepare to take you from unsuccessful to successful or to take you from your weaknesses to your strength. Okay. So I always say with any of the one on one sessions, reach out by phone or email so we can truly assess what you need and we can talk through this and design it to get it prepared for you. Okay. But y'all know what to do. As always, make sure you meet me back here. Happy studying. Bye, y'all.